this is Leeza, and today I have a very special guest on my channel. It's YouTube's favorite urologist, the wonderful Dr. Rena Malik, and she's going to be answering your most asked questions about the penis. Rena, thanks so much for joining me.
Oh my gosh, I'm so happy to be here. Thank you so much for having me.
A lot of men write in with questions around how to increase penis size. How can I make my penis bigger? And first of all, I just want to say that I think penis size matters far less than most of us seem to think that it does. But even so, since I get asked this question so often, Dr. Rena, I'd love it if you could just help us sort through the myths and the facts when it comes to the topic of penis enlargement.
Yeah, absolutely. So I think first off, it's important to know what the average size is, right? Because I think people have these really unrealistic expectations of what their length of their penis needs to be. And so actually, if the way to measure it, or the way that we've measured it as researchers to find the average size, is to actually stretch the penis and take a ruler from the base of the penis to the tip and you measure it. And the average size is 13 centimeters. And so that's, average and completely within normal. And so I think a lot of people have kind of body dysmorphia and they feel like that's too short or they're too short, even if they're average or above average. I think if you look at studies where they've asked people, like 50,000 couples about how satisfied they are with their penile length, while 85% of men will say they're not, 55% of women will say that they totally are, even in that group of men who feel like they're not. So I think that more women are satisfied with whatever length you have than you think. So a lot of it is anxiety from society or from other people's discussions that people manifest and being really concerned about the length of their penis. And I'll say, I see it all the time when we'll say, I'm really worried. And I say, you have a completely normal, healthy, vibrant penis with a good length. And that's all you need, right? And you can do so much with that. And as far as increasing penile length, I mean, there's things that have been studied for what we call micropenis, or penis that is clinically considered too short or too small. And those are really the only indications for doing any sort of intervention, surgically or medical, to increase penile length. But to be honest, there's not many things that truly increase penile length. So if you look at all the things that are out there, pills, injections, so on and so forth, nothing has been studied rigorously, scientifically, to say that it actually causes an increase in penile length. So a lot of people are preying on these anxieties of men and selling products that they think will actually increase penile length, but in fact, they won't do anything. They'll just empty your pockets. And so you have to be really careful and really thoughtful and don't buy into all that. The only thing outside of surgical interventions that have been only studied in men with micropenis that can actually increase penile length is a penile traction device. And a penile traction device has been shown, if you're using it for many hours a day over 6 months, you can increase your penile length by about 2 centimeters. And a penile traction device is kind of this fancy thing that you can buy that gently puts stretch on a penis over time. And these are medical grade products. They're not like sex toys or anything like that. And they've actually been studied in research studies to see that this can occur, but there are certainly side effects with them, and they have to be used carefully, thoughtfully, and in a very monitored fashion, because you can get bruising, you can cause damage, and people try to do this at home with things like jelqing, which is essentially where people use their hand in a certain okay shape and try to stretch out their penis, and they can actually create micro tears or small little tears in their penis, and that can lead to erectile dysfunction or problem with erections down the road. So I tell people, one, you're great the way you are, and two, doing things or extravagant things to increase your penile length can actually cause damage and harm and make it more difficult for you to get an erection. So please don't try to do anything on your own at home. Don't go buy things and try to figure it out by yourself. See a urologist, talk to them about it. If you're really serious about something, again, you need to know the benefits and the risks of what you're doing before you go ahead and do it.
As you said, there are so many products being marketed to men simply preying on this insecurity around penis size. These pills and potions and lotions that are not going to do anything other than empty your wallet and maybe even harm your health. So thanks so much for clarifying that, Dr. Rena. Another thing that people seem to be really keen to understand better is whether there are any significant pros and cons to whether you're circumcised or uncircumcised.
The benefits to circumcision are a couple. One is it reduces your risk of sexually transmitted infections like HIV, because the thought is that when you are having intercourse, some of the viral particles can get stuck in the foreskin, and then you can have more more risk of getting sexually transmitted infections. The other thing is that it almost entirely eliminates the risk of penile cancer. And three, it does reduce the risk of having infections of the foreskin and of the glands, because that can become a problem for men of any age. And so those are the benefits to circumcision. That doesn't mean that you absolutely have to do it. It's a personal choice. And as an adult, I would say if you're considering circumcision, you do need to realize that there are risks to that as well. It's a very simple procedure that we do, but it does have risks of changes in sensation. A lot of times people will have increased sensitivity, or they'll feel like, even brushing the skin, their underwear on the skin of their penis can be sensitive and painful in the first month or so after getting a circumcision. And then some people will have changes in sensitivity. Up to about 20% of people will have some changes in sensitivity after circumcision that will be undesirable. And many people, the reason to get it for medical purposes is if you're getting recurrent infections of the foreskin, if you're having phimosis where the foreskin doesn't retract over the head of the penis. Those are major reasons to get, or if you have skin diseases of the penis, those are major reasons to get circumcised. Of course, if you have a penile cancer, and if you see something on your penis that concerns you, please see a doctor. Don't delay, because that is something that could, if it's a cancer, it needs to be treated immediately. But those are the reasons to get circumcised. And otherwise, it's a personal choice, and you need to be aware of the risks before you proceed with any sort of surgery, and especially a circumcision.
Since the decision around circumcision is often made for men in infancy for religious or cultural reasons, in the sense that certain cultures have baby boys circumcised, whereas in other cultures it is not traditionally done, do you think it's fair to say that most adult men don't need to worry too much about this either way? That unless there's a specific health concern in adulthood, really, whether you're circumcised or uncircumcised doesn't matter all that much, and you can have a very fulfilling sex life either way, right?
As far as, living a life full of pleasure, having, very pleasurable, intimate relationships and intercourse, there's no drawback from that regard of getting a circumcision when you're younger or keeping your foreskin. You can have equally good, pleasurable intercourse and pleasurable sexual relationships, but really the difference is that risk of HIV, sexually transmitted infections, is lower in men who've been circumcised. And that's really the only difference that we can say, scientifically proven difference in getting circumcised versus not.
Another very common concern from men and penis owners seems to be premature ejaculation. How can I last longer? That's one of the most common questions I get. So what should people understand about premature ejaculation, and what can they do about it?
Absolutely. So premature ejaculation, the clinical definition is actually ejaculating before you or your partner desires. So there's no numerical number in the clinical definition, but a lot of people are usually having that within the 1 minute of penetration. And so the average length of what we can say is penetrative intercourse, right? Not including foreplay and other things, but from the instant the penis enters the vagina to ejaculation is about 5 minutes. And so that's average, and that's pretty typical. Basically, if you're having issues and you're having what you think is premature ejaculation by you and your partner are having distress because you're ejaculating before you're ready for that, the ways to manage that or try to work on that, at least medically, the things that we offer. One is, certainly there's a lot of thoughts and things in your brain that can affect your performance and can also cause you to ejaculate sooner than you're ready. So sometimes talking to someone, a therapist or a psychologist about your performance can help. Also, doing things like what we call the stop-start technique. So kind of, you start having intimacy with your partner, and then your partner maybe squeezes the glands of your penis, and you stop, and then you restart again, and do that three or four, and on the fourth time you ejaculate, and that will kind of slowly over time increase your duration before you're ejaculating. Other things that can help, off-label, what we do in the United States, at least, there's no recommended medication or treatment for a premature ejaculation that we can give you, but one is a sort of numbing cream or spray, and those are usually made with lidocaine and prilocaine and applied to the penis about 20 minutes before sex. You do need to wash them off if you're because you don't want your partner to get numb as well, because it will numb the penis a little bit. And the other thing that we offer is antidepressant medications, either daily or before intercourse. And these do work quite well. About 70% of men will achieve longer, what we call intra-ejaculatory latency time, or longer time before they ejaculate. But it's hard to keep going on those medications, and a lot of people stop taking them. So there are good options, and this is actually very, very common. About 30% of men have this problem, so you're certainly not alone if you're suffering from it. And so please don't feel alone, but only 9% of people actually go to their doctor to talk about it. And so, you're not alone. This is very, very common, and it's very different from erectile dysfunction, which is where you're not getting an erection that's firm enough to actually penetrate. And it's important to distinguish those things, because if you go to a doctor and you explain that your penis isn't working, they're going to think that you have issues with erections, when really it's that you're ejaculating too soon.
Just a little reminder to people, there's so much more to sex than just penetration. So sometimes even just rethinking how you look at sex can make a huge difference. How about we start adding equal value to non-penetrative acts like oral sex or stimulation of the body parts other than the genitals, or even penetration with a finger or a toy. There's so much potential for pleasure that actually has nothing really to do with how big or hard or long-lasting your penis is.
Oh, 100%. And before I go on to that, I just want to reinforce, Leeza does a great job talking about women's pleasure and using, other ways to incorporate stimulation of the clitoris. And 100%, that is really something that I think men should focus in on and try to incorporate in their sexual encounters. And I know she talks about this all the time, but the clitoris is basically the same as the head of the penis embryologically, meaning when you're born and you're developing as a little fetus, those things are identical and then develop on to be the clitoris or the penis. And so, yes, intra-ejaculatory latency time is actually more for your enjoyment, for you to get, ejaculation. But women, 95% of women need some sort of clitoral stimulation to climax.
On the subject of erectile dysfunction, since you did just mention it earlier, that is another concern a lot of men seem to have. They write in asking about what to do when they have trouble maintaining an erection or getting an erection. And a lot of people are also very curious about Viagra, because I think there's the temptation to see it as this sort of quick fix for a bigger, harder penis. But I think it's important for people to understand that there are contraindications, that, it's really important to consult with a doctor before taking that medication. So could you tell us a little bit about erectile dysfunction and Viagra, and, what it is, who can take it, what you've got to be wary of?
Erectile dysfunction is defined basically as the inability to get an erection that's firm enough to actually have penetrative intercourse. And the treatment of this is often medications, but there are other treatments. So we'll focus for this answer on just the medication options. So what happens when you get an erection, to really understand it, is your body gets aroused, right? Because of a visual, like something you're seeing, something you're hearing, something you're smelling, something you're touching. And your body gets aroused, and it starts creating this thing called nitric oxide. And that's like a fire starter, like an ignition for the erection to happen. And that once it starts, your body starts making all these little messengers. And the messengers, while they're around, sustain or keep the erection going. And so what the Viagra or sildenafil is the generic term for it, what that does is it keeps those messengers around. It prevents the breakdown of those messengers by preventing one of those enzymes that breaks down the messengers from working. And so that's how it works. And the key to know about when you're taking these pills is that you need still to have arousal or stimulation for them to work. They will not just work on their own. You can't just pop a pill and get an erection. It's not going to work that way. But the reason that you really need to see a doctor is because there's a lot of nuances in one, how to take the medication, the side effects of the medication, and there are a lot of medications that may interact with it, and it can be quite dangerous. So I'll go over a couple of things, but essentially, when you take the medication, you need to take it about an hour to 30 minutes before sex. It takes about 20 minutes for onset and will last for about 4 hours in the bloodstream. So that's kind of the time set of taking it. And you need stimulation for it to work. For sildenafil specifically, they need to be taken on an empty stomach. The more fatty food that you eat, the less effective the medication will be. So if you're taking it, eating a big meal, it's not going to work. And then there are side effects very commonly like headache, flushing, having some kind of heartburn, things like that are very, very common. The one thing that I worry about with this medication is you can get visual changes. And those visual changes may be that you'll see things that are blue and see things that are green a little bit differently. And if you have those complications, you need to stop that medication right away. The other thing is if you take too much, you can get what's called a priapism, or an erection that lasts longer than 4 hours. And while this is rare if you're taking it as dosed or as prescribed, if you take too much, that's a real dangerous problem and requires you to go to the emergency room and get that erection drained with a bunch of interventions that can be quite scary, and it can actually make it more dangerous and difficult to get erections later on. So you don't want to mess with these medications. Also, if you have, the biggest thing to know is if you're taking anything that you maybe put underneath your tongue because you get pain in your chest, you cannot take these medications with that because it can cause, life-threatening low blood pressure, meaning that you could die because your blood pressure could drop so low. So you have to be very careful. And if you have problems with your liver or your kidney, you have to change the dosing of this medication. So there's a lot of specifics and a lot of reasons that you need to see your doctor before starting this sort of medication.
Thanks so much for clarifying that. Okay, final question. Let's talk about masturbation. I receive so many questions every day about this, and I think because of all the guilt and shame that people are conditioned to feel around the act, it's common to kind of have all these myths around all the terrible things that could happen to you if you masturbate. I mean, people ask if masturbation causes acne or hair fall or, loss of semen quality or loss of athletic ability, or whether it'll affect their performance in bed, whether it can cause blindness. I mean, the list of things that people are worried about when it comes to masturbation is endless. And I'm always telling them masturbation is a normal and healthy part of sexuality. It is okay if you masturbate, it is okay if you don't, and really there are no ill effects on health. But people won't believe me. They'll be like, jhooti kahin ka, the no fap movement and all of that. So I'm hoping, since you're a doctor, maybe they'll believe you. Why don't you tell us, what's the deal?
Absolutely. So masturbation is the ultimate form of safe sex and has so many great benefits, right? You can have improved sleep, improved concentration, reduce your stress levels. And that is so valuable, right? It's something so easy you can do. You don't need a medication to reduce your stress. You don't need a medication to help you sleep better. You can masturbate to do those things. And these myths, there's so many myths about masturbation, right? I'll talk about a couple of them. I think, one, there's no effect on your semen parameters at all. There's no effect on your performance. So, they worry about their testosterone levels. And while you're getting stimulated, your testosterone will go up. And immediately after you masturbate, it'll go down and then it'll go back up. So there's no scientific evidence to say that your testosterone is going to change or that your performance is going to suffer. In fact, it may be better, right? Because your performance in like athletic way may be be better, and even in a sexual way, right? Because if you know how to achieve orgasm and pleasure yourself, you'll feel more confident in your own encounters with your partner, and that can actually improve your performance. The caveat to that is if you feel a lot of guilt or shame around masturbation, that there's a big psychological component, meaning that your brain can really affect how you perform. And so if you're feeling a lot of guilt and shame about it, you might find yourself actually having difficulty performing. And that, may then solidify in your brain that, oh, masturbation leads to poor performance, but it's really because of the thoughts in your brain. Otherwise, there's really no link to having issues with erections or performance in the bedroom. And again, it's very, very safe and has a lot of benefits. The other thing besides guilt is that they have seen some impacts because a lot of people masturbate while watching pornography. And they've seen that using excessive pornography can lead to unrealistic expectations in the bedroom or with your partner. And that can make you have less satisfying sexual intercourse or not be able to perform quite as well. And it's not because of the masturbation, it's actually because of the unrealistic expectations that have been set watching pornography. And so those can be linked, but really they're completely separate scenarios. And lastly, people will worry that they can't orgasm as well during intimacy with their partner because of masturbation. And I think that sometimes your body can get sensitized to certain stimulations, either the pressure you're providing, the tools you're using, the toys you're using, and that can't really be replicated in the bedroom necessarily. The only time I would say that masturbation is dangerous is if you're using really aggressive types of masturbation, like very intense pressure, or you're like prone masturbating and hitting yourself against a wall or a firm bed or things like that. You can actually cause injury to your genitalia. But for the most part, if you're using normal, safe, healthy masturbation practices, it's a great thing to do and there is no harm.
Thanks so much, Rena. It was so great talking to you, and I hope that everyone watching has had several of their concerns alleviated from all the valuable information you've shared. Thank you so much.
Thank you so much for having me.
I hope you liked this video. Please give it a big thumbs up if you did. Don't forget to share it. And of course, we'd love it if you subscribe to our channels. I'm going to put a link to Dr. Rena's channel in the description. Also, please follow me on Instagram. If you like sex ed, you're going to love what I put out there as well. And if you have any thoughts or questions, please leave them in the comments. I will see you soon. Bye.